Thank you for your interest in the Rural Health Clinic program. You have accessed Part 4 of the 5-part session entitled Rural Health Clinic 101. The Rural Health Clinic 101 session is designed for individuals who may not be familiar with the Rural Health Clinic program. For additional information about the RHC program, please access Parts 1 and 3 and Part 5 of Rural Health Clinic 101, as well as other focused educational Rural Health Clinic webinars sponsored by the Wisconsin Office of Rural Health. Part 4, Rural Health Clinic Survey and Certification. Compliance with the Rural Health Clinic qualifications is determined through an unannounced survey conducted by a state agency or a private deemed organization during the RHC certification process. Once your clinic has received approval of the initial enrollment application from the Medicare intermediary, which is Form 855A, and the clinic has determined that it's ready for survey, the clinic can then request the initial RHC survey from the state or one of the two currently deemed agencies. And currently those two agencies are the compliance team or Quad ASF. CMS has recently indicated to the states that RHC surveys are a lesser priority than other surveys. And since these surveys are conducted on behalf of CMS, CMS determines which surveys take precedence. So it can take an extended time sometimes for the state to perform that initial survey. Therefore, you'll want to check with the state to see if they are performing initial surveys and how far they are out for those initial surveys, and if you might want to consider contracting with an accrediting agency. Keep in mind, there are no fees with a state survey, and when contracting with an accrediting agency, the clinic is subject to the agency's fee schedule. So again, clinics will want to check with the state and see how far out they are if they are performing initial surveys, and then consider if they want to move forward with an accrediting agency. Note that if your organization has multiple clinic sites that are seeking certification, each rural health clinic is separately certified, and therefore each location will require a separate survey, and in addition, a separate contract with the accrediting agency. Each rural health clinic survey is unannounced, so a new rural health clinic must provide notice of full operational readiness, either a request to the state for the initial survey indicating that you're in compliance with the conditions of participation in the rural health clinic program, or perhaps a statement to the accreditation agency indicating that you're ready for survey. It is possible to black out dates when a survey cannot be effectively performed. This may be due to, let's say you have a clinic manager that's going to be out an extended period of time, or you know that the clinic's going to be scheduled during a certain week. You can actually black out those dates. But again, keep in mind that the survey is a surprise and you cannot request a survey on a certain date. The survey standards that the surveyor will use are based on the Code of Federal Regulations 42. So it's 42 CFR 491, which contains the RHC conditions for certification. In addition, any relevant state regulations will be looked at. For example, if there's nurse practitioner or PA supervision or practice acts that are enforced by your state, that will be looked at. And if you are using an accreditation organization, that accreditation organization may have additional standards that actually exceed the conditions of participation for rural health clinic certification. There should be no surprises on those standards, and your accrediting agency should let you know about those additional standards that they will require as part of their accreditation program. As a reminder, these are the overarching requirements of a rural health clinic. One, we have to be located in a rural area as designated by the U.S. Census, and we have to have a current underserved designation, so have a health professional shortage area designation or a medically underserved area designation. In addition, our clinic has to be predominantly providing outpatient primary care services, and we have to have a mid-level practitioner on site or available to see RHC patients at least 50% of the time that the clinic is open. Keep in mind that this is not 0.5 FTE, that this is 50% of the time that the clinic is open. Therefore, if your operating hours of the clinic are 20 hours, your mid-level practitioner has to be available to see patients 10 hours a week. In addition, the clinic has to operate under medical direction of a physician, and there are 6 basic lab tests that the clinic has to have the ability to perform. So the surveyor will be looking at those requirements. Again, the Code of Federal Regulations, if you go to your search engine and type in 42 CFR 491, it will then get you to the Code of Federal Regulations that are pertinent to the Rural Health Clinic program. And these are spelled out in different sections of the regulations. So one, we have compliance with federal, state, and local laws. If your clinic has to be licensed in your state, that will be looked at. Are there any other requirements by state and local laws for operating your clinic? That may be looked at. Location of the clinic. Again, is the clinic located in a rural area, and does it have a current shortage designation, meaning within the last 4 years was that designation made? Physical plant and environment. The surveyor will be checking to make sure that the clinic is safe for patients and its employees. And what's the organizational structure of the clinic? Who owns the clinic? Who is the clinic administrator, medical director, etc.? And that's something that should be spelled out in your policy and procedure manual. Staffing and responsibilities. Is the physician and the non-physician practitioner involved in the preparation of the RHC policies and procedures? And do they ensure that they're being followed? So is it evident that the practitioners are involved in the preparation of the policies and procedures and know what's in those policies and procedures? So a survey may ask about specific policies to see if they know about them. Is a non-physician practitioner available to see patients, again, at least 50% of the time that the clinic is open? Provision of services. As a condition of participation in the Rural Health Clinic program, again, the clinic must be predominantly providing primary care services. And these are defined as primary or family practice, internal medicine, pediatrics, and women's medicine. Keep in mind that a clinic can have specialists in an RHC, but again, that primary care predominance has to be evident. Patient health records. A surveyor will want to make sure that patient health records are properly maintained and maintained in accordance with the Rural Health Clinic policies and procedures that are in place. Program evaluation. This may be something new if you're brand new to rural health clinics, but as a rural health clinic requirement, it's indicated that an annual program evaluation be performed that includes a review of the utilization of clinic services, including at least the number of patients served and volumes of services. A representative sample of both active and closed clinic records have to also be included in the review, as well as reviewing the clinic's healthcare policies. And the purpose of this review is really to determine if the utilization of the services was appropriate, if those policies that are established, if they were followed, and if any changes were needed. So lastly, the findings of the review should determine if any corrective action is necessary. And a surveyor will want to see that any corrective action that was deemed necessary was actually taken. So this isn't a report that just sits on a shelf. It's actually used annually to make changes within your clinic. RHC survey checklists and resources are available from the accreditation organizations. The compliance team has a surveyor worksheet that you can actually access on their website. You can request that from them. And Quad ASS, the other deemed accrediting agency, has a standards manual and checklist on its website that you can access. And I recommend in either case really getting to know both of these documents quite well. There's also a CMS 30 for state surveyors that state surveyors use to perform the survey and can serve as a checklist for you kind of during a mock survey case. And then State Operations Manual Appendix G is a guidance to surveyors, and you can type this in your search engine as well, and this will pop up. This was last updated in 2018 and gives suggestions and explicit directions to surveyors when conducting the on-site RHC survey. A typical day of a survey agenda is an on-site meeting with key leadership. So the surveyor will get together with key leadership, clinic administrator, medical director, etc. at the clinic and explain what's going to happen during the survey. They'll probably first ask for your RHC policy and procedure manual, and they'll want to make sure that you have that available and that everyone knows where that's available. They'll take a tour of the entire facility, making sure that the clinic building, and again, patient safety and employee safety is important when they're reviewing the facility. They'll observe medication storage and disposal practices and make sure that those policies and procedures are performed. And they'll observe infection prevention practices. In addition, they'll often interview staff and providers to make sure that they're aware of the policies and procedures that are in place. And they'll also perform a patient health record review. Personnel files are often requested as well, so you want to make sure that you have access to those. And in the end, they'll hold an extra interview and let you know the findings of their survey. Once that survey is complete, the surveyor will then notify the clinic of any deficiencies, and typically this is stated in the exit interview, but you will receive a report of any deficiencies. And if any plan of corrections are necessary, they'll indicate a plan of correction and the due date for that plan of correction. Once the clinic passes the Rural Health Clinic survey, that recommendation then is sent to the state, and the state then forwards the recommendation on to the CMS regional office, who makes the final determination. The CMS regional office, when making that final determination and granting approval, they provide a letter that indicates the RHC provider number, which is often referred to as the PTAN or CCN, and the effective date of that RHC certification. And the effective date is the date that the clinic passes the Rural Health Clinic survey. So if you pass on the date of the survey, then that's the date that your RHC certification goes into effect. If you have a plan of correction, the date that the agency accepts the plan of correction is the date of RHC certification. Thank you again for your interest in the Rural Health Clinic program. You have participated in part 4 of the 5-part session entitled Rural Health Clinic 101. For additional information about the RHC program, please access parts 1 through 3 and part 5 of Rural Health Clinic 101, as well as other focused educational RHC webinars sponsored by the Wisconsin Office of Rural Health. Thank you.